Management of peptic ulcer. So in this video, I'm going to tell you about management means which includes investigations and the treatment. So first, we'll see about the investigations. To know the cause of pain in abdomen, your doctor may order some tests. Testing for H. pylori infection is essential in all patients with peptic ulcers. H. pylori is a bacteria. I already told you in earlier video that it is an important factor in the peptic ulcer. First, blood test. CBC count, which also known as complete blood count, and iron studies are useful to detect anemia. Anemia is an alarm signal for peptic ulcer disease, and further investigations with endoscopy to rule out other disorders. Second is liver function test. Liver function test, amylase and lipase may also be useful depending upon signs and symptoms. Urea breath test. Urea breath test detect active H. pylori infection by testing for the enzymatic activity of bacterial urease. For a urea breath test, you will drink a special liquid that contains urea, a waste product that your body makes as it breaks down protein. If H. pylori are present, the bacteria will change this waste product into carbon dioxide and ammonia, a harmless gas. Carbon dioxide normally appears in your breath when you exhale. In the presence of urease produced by H. pylori, labeled carbon dioxide, that is high isotope carbon-13 or radioactive isotope carbon-14, is produced in the stomach, absorbed into the bloodstream, diffused into the lungs, and exhaled. This test has high sensitivity and specificity, but it needs expensive mass spectrometer. Fourth is stool test. In the presence of H. pylori bacteria, antigens can be seen on a stool, also called as fecal antigen test. Fecal antigen testing identifies active H. pylori infection by detecting the presence of H. pylori antigens in stools. This test is more accurate than antibody testing and is less expensive than urea breath test. Fifth is endoscopy. Upper GI endoscopy is the preferred diagnostic test in the evaluation of patients with suspected PUD. It is highly sensitive for the diagnosis of gastric and duodenal ulcers. It allows for biopsies and cytological brushings in the setting of a gastric ulcer to differentiate a benign ulcer from a malignant disease, and allows for the detection of H. pylori infection with enteral biopsies for a rapid urease test and or histopathology in patients with peptic ulcer disease. An upper GI endoscopy is performed by inserting a spatial lighted camera on a flexible tube into a person's mouth to look directly into the stomach and the beginning of the small bowel. This flexible camera carefully inspects the most likely areas for ulcer to be located. Treatment. Now, how you're going to manage the case of peptic ulcer? The aim of management are to relieve symptoms, induce healing, and prevent recurrence. H. pylori eradication is the cornerstone of therapy for peptic ulcers, as this will successfully prevent relapse and eliminate the need for long-term therapy in the majority of patients. H. pylori eradication. The recommended primary therapy for H. pylori infection is proton pump inhibitor based triple therapy. So proton pump inhibitor plus 2 antibiotics. From amoxicillin, clarithromycin, and metronidazole for 7 to 14 days, but high dose, if it has a high dose, so twice daily for longer durations. 14 days is more effective. Amoxicillin should be replaced with metronidazole in penicillin allergic patients only because of the high rate of metronidazole resistance. So, PPI, that is proton pump inhibitor, plus clarithromycin plus amoxicillin per orally twice daily for 14 days, or PPI, that is proton pump inhibitor plus clarithromycin plus metronidazole in case of penicillin sensitive, per oral twice daily for 14 days. Another is quadruple therapy. Quadruple therapies for H. pylori infection are generally reserved for patients in whom the standard course of treatment has failed. A quadruple therapy regime consists of omeprazole, bismuth substrate, metronidazole, and tetracycline (OBMT). O. Omeprazole, B. Bismuth substrate, metronidazole M, and T for tetracycline for 10 to 14 days. For those who are still colonized after 2 treatments, the choice lies between a third attempt guided by antimicrobial sensitivity testing, rescue therapy, levofloxacin, PPI, and clarithromycin, or long-term acid suppression. Now, if you eradicated H. pylori, now how will you maintain? So, maintenance treatment. Continuous maintenance treatment should not be necessary after successful H. pylori eradication. For the minority who do require it, the lowest effective dose of PPI should be used. And surgical treatment. Surgery is now rarely required for peptic ulcer disease, but it is needed in some cases. General preventive measures. First is unnecessary use of NSAIDs should be avoided. Most of the time people use NSAIDs, analgesics, if they have pain. If they can bear the pain, they should not use analgesics or NSAIDs. Smoking is always dangerous for health, should be avoided. Use of aspirin should be avoided. Use acetaminophen or non-acetylated salicylates when possible. Alcohol use should be avoided and follow healthy lifestyle. For more updates on healthy lifestyle and medical problems, visit www.askmeforadvice.com. Thank you for watching. Do not forget to like and subscribe.